Hi, this is Abby and Natalie, and we're here today to talk to you about Duchenne and Becker muscular dystrophy. Duchenne muscular dystrophy, also known as DMD, is a genetic disorder characterized by progressive muscle degeneration and weakness. It is one of 9 types of muscular dystrophy.
Some symptoms of Duchenne and Becker muscular dystrophy contain falling down often, having trouble climbing stairs, having scoliosis, short and tight muscles in his legs called contractures, headaches, problems with learning and memory, shortness of breath, sleepiness, trouble concentrating, can also damage the heart, lungs, and other parts of your body. This particular type of muscular dystrophy can affect the body in this way. Their muscle weakness can begin as early as age 3, first affecting the muscles of the hips, pelvic area, thighs, and shoulders, and later the skeletal muscles in the arms, legs, and trunk. Calves are also often enlarged. By the early teens, the heart and the respiratory muscles are also affected. This particular type of muscular dystrophy is a mutation, and when it's flawed, it leads to DMD.
How is this disorder inherited? DMD carriers are females who have a normal dystrophin gene on one X chromosome and an abnormal dystrophin gene on the other X chromosome. Most carriers of DMD do not themselves have signs and symptoms of the disease, but a minority do. Symptoms can range from mild skeletal muscle weakness or cardiac involvement to severe weakness or cardiac effects that can begin in childhood or adulthood. How is this disorder treated? This disorder can be treated with anesthesia, braces, standing frames, and wheelchairs, cardiac care, contractures, diet, exercise, and respiratory care.
There is no cure for any form of muscular dystrophy, but treatment can help prevent or reduce problems in the joints and spine to allow people with muscular dystrophy to remain mobile as long as possible. Treatment options include medications, physical therapy, and surgical procedures.
So some medications that can be recommended by a doctor consist of corticosteroids, such as prednisone, which can help improve muscle strength and delay the progression of certain types of muscular dystrophy. But prolonged use of these types of drugs can cause weight gain and weaken bones, increasing fracture risk. They can also recommend heart medications, such as angiotensin converting enzyme inhibitors or beta blockers if muscular dystrophy damages the heart.
Several types of therapy and assistive devices can improve quality and sometimes the length of life in people who have muscular dystrophy. For example, it can include range of motion and stretching exercises. Muscular dystrophy can restrict the flexibility and mobility of joints. Limbs often draw inward and become fixed in that position. Range of motion exercises can help keep joints as flexible as possible. Exercise in general, such as low-impact aerobic exercise, like walking and swimming, can help maintain strength, mobility, and general health. Some types of strengthening exercise also might be helpful. It's important to talk to your doctor first because some types of exercise may be harmful. Braces can also keep muscles and tendons stretched and flexible, slowing the progression of contractures. Braces can also aid mobility by providing support for weakened muscles. Mobility aids such as cane walkers and wheelchairs can help maintain body mobility and independence. Last, breathing assistance help as a sleep apnea device that may improve oxygen delivery during the night. Some people with severe muscular dystrophy may need to use a machine that forces air in and out of their lungs, such as a ventilator.
Surgery may also be needed to correct a spinal curvature that could eventually make breathing more difficult.
When being diagnosed with this type of muscular dystrophy, your doctor is likely to start with a medical history and physical examination. The tests done are checking their CG level, genetic testing, muscle biopsy, and genetic counseling is an option.
After that, your doctor may recommend enzyme tests. Damaged muscles release enzymes, such as creatine kinase, also known as CK, into your blood. In a person who hasn't had a traumatic injury, high blood levels of CK suggest a muscle disease, such as muscular dystrophy.
Another recommendation would be a muscle biopsy. It's a small piece of muscle that can be removed through an incision or with a hollow needle. Analysis of the biopsy of the tissue sample can distinguish muscular dystrophies from other muscle diseases. Heart monitoring tests can also be a recommendation. These tests are used to check heart function, especially in people diagnosed with myotonic muscular dystrophy. Another recommendation is the lung monitoring test. These tests are used to check lung function.
An electromyography is another thing your doctor may recommend. An electrode needle is inserted into the muscle to be tested. Electrical activity is measured as you relax and as you gently tighten the muscle. This changes in pattern of electrical activity can confirm a muscle disease. Another recommendation your doctor can make is genetic testing. Blood samples can be examined for mutations in some of the genes that cause different types of muscular dystrophy.
DMD comes from the X chromosome, and a man with DMD can't pass the flawed gene to his son because he gives a son a Y chromosome, not an X. But he certainly will pass it to his daughters because each daughter inherits her father's only X chromosome. They will then be carriers, and each of their sons will have 50% chance of developing this disease, and so on. It is more common for boys to have this disease because of their chromosomes. This certain muscular dystrophy affects one of 3,500 boys worldwide. Duchenne and Becker muscular dystrophy is a sex-linked disease. The particular chromosome that it's located on is the X chromosome. It's also a recessive disease.
How many and what type of people are likely to have the disorder? Each son born to a woman with a dystrophin mutation on one of her two X chromosomes has a 50% chance of inheriting the flawed gene and having DMD. Each of her daughters has a 50% chance of inheriting the mutation and being a carrier. Thank you for watching our presentation. I hope you learned just as much as we did about muscular dystrophy.